Hello, everybody. Very excited that so many of you are here. Good morning, good afternoon, good evening, wherever you are. We saw that people from all across the globe are logging in, and we would like to also extend Ramadan Kareem to all of those who are observing. And thanks for joining us, even though it's the high holidays for you. My name is Payal Parekh, and I am the Director of Health at Power for All, and we're one of the co-sponsors of this event today, Electrification of Rural Health Clinics in Zambia using off-grid solar solutions. And we're working very closely with other co-sponsors, most notably the government of Zambia, the Health Ministry, as well as the Energy Ministry, the African Clean Energy Technical Assistance Facility, World Resources Institute, again, my organization, Power for All, Tetra Tech, and the Foreign Commonwealth and Development Office of the UK government, formerly known as DFID. We've got a great program for you today. On the one hand, we're very, very excited that Mr. Steve Beale, the head of the FCDO office in Zambia, has agreed to open the event. And following that, we have 4 distinguished keynote speakers who are coming from government, intergovernmental organizations, as well as task force, who are going to give us an overview of what it needs in order to make health outcomes be improved in Zambia with regards to off-grid solar solutions. And after that, well, actually in between, I think the most important part is we're going to leave time and space to hear from all of you, your questions and comments. You should be able to see the questions and answer box on the Zoom. And please, as the event is going on, don't be shy to write in your questions and comments, and we'll be sure to collect them. And there will be some time at the end of each of the 2 sessions to get those questions into the speakers. And the second part of the panel is also very exciting. It's going to be a discussion, and it's going to be really focusing much more on what is the situation on the ground, how do we implement these kind of projects, what are the type of appliances that are needed, as well as how do we bridge the big picture with the situation on the ground. So without further ado, I'm going to cede the floor to Mr. Steve Beale, who's going to open the event today. And we're very, very honored that you're able to be here with us today, Steve.
Thanks, Payal. I think there's so many people on this call who know me already that I'm not sure they'll necessarily feel so honoured to have me join them. But it's nice to be with you. And as I say, I think my role is simply to welcome people. So I'm not really I wasn't planning to say too many words, but just so first of all, kind of a big welcome to everyone that's joined. A big thanks to the Africa Clean Energy Facility and others that are kind of have put their time into the organisation. And then I think just to very briefly say, you know, I think the UK obviously does lots of different work, lots of different types of development work in Zambia, and I think it's quite fitting that this one brings together energy and health, because I think it's 2 sectors in which we've historically done a lot of work in Zambia, and you know, but I think it's an area where there's a kind of plenty of scope now for innovation and for doing different things. And I think it's kind of great that the ACE work has built on, you know, the roles of the Off-Grid Task Force and others in actually kind of bringing this conversation together. So I think in terms of the UK's role and the areas that we're interested in, but also, you know, in the context of the COVID pandemic, but also kind of wider health challenges in Zambia, is actually a topic that's kind of really critical, I think, and probably somewhat overdue, but it's actually, but certainly great that it's actually happening today. And so I think my background's actually in the energy sector, less so the health side. But so I think the things I'm probably looking forward to. So you know, I think there's certainly a need to think creatively I think at the moment, in terms of devising solutions to the problems that we've got, there's no constraints, I think, in terms of how people need to think about addressing some of those challenges. And so I think we collectively need to be quite creative about the kind of range of solutions that we consider and think about. I think that within, particularly, in the context of Zambia, and actually only yesterday I was out near Chisamba looking at some of the work under the Social Cash Transfer Program, and had the opportunity to see a few health facilities up there, and then obviously seeing others around the country. I think kind of recognizing that we need to think about the right solutions for the right circumstances. There's a whole range of different challenges that exist in Zambia, and even the kind of distribution logistics side of what's possible to get to different areas, and the costs of doing so, I think require us to think both creatively, but also just to kind of understand that there's not a kind of one size fits all solution to this, or I would have thought not anyway. But I think we kind of need to consider, what those right solutions are for the circumstances. And then, as I think Sebera is particularly going to talk about, I think just needing to explore the kind of different funding and financing mechanisms that are possible, and particularly how we engage the private sector in this. It's no secret that the government itself in Zambia is somewhat kind of short of resources to deploy into this type of challenge. Actually, it's also not that much of a secret that actually many of the international donors that traditionally have supported this work are also not, have their own kind of constraints in terms of funding large kind of grant-funded programs of work, and therefore I think the role of the private sector in coming up with kind of new ways of funding and financing is really, really important. But so I think with that, and I think someone probably needs to go on mute in terms of the feedback on the line. But so I think with that, again, just to kind of reiterate my thanks to everyone that's joining today and participating in the conversation. Particularly a big thanks to PS Malama, who I know is exceedingly busy with other things right now, particularly with COVID vaccines having arrived in the country very, very recently. So big thanks to him, but also to all the other panelists that are going to be engaged today. And I'll hand back to Payal, I'll hand back to you or other moderators. So thanks very much.
Thank you, Steve. And thanks for really bringing together the focus on these two sectors coming together. And it's actually great to have you do the opening because you are so familiar with the players much more than I am. And with that, it's my honor to open up the keynote speakers. And our first speaker will be Ms. Sebera Khan, who probably those of you that have been working in this space in Zambia and Eastern Africa know her well. She's the Beyond the Grid for Africa Liaison Manager and Senior Expert, and is based and from Lusaka. She also supports the government as the focal point of the Off-Grid Energy Task Force, a multi-stakeholder forum which addresses barriers to market entry and provides information on opportunities. And I think the best part is that this was actually her brainchild and her idea. And it has come to fruition and has proven to be very important task force in the country. And her experience doesn't end there. She also has vast market experience in climate change, renewable energy, as well as finance across sub-Saharan Africa. And she's also currently, in addition to the task force, leading a team on the design of an impact investment fund for Zambia. So today she's going to speak to us about the important coordination role that the Off-Grid Energy Task Force plays. And as Steve mentioned, she's also going to touch a bit on financial instruments and the role that coordination plays there as well. Sebera, I'm going to turn it over to you, and I'm going to now share my screen so that everyone can see the presentation that you put together.
Fantastic. Thank you very much, Payal. Good to be here for this very important webinar. Fantastic to see such a large audience, and an honor to be with on the platform with Steve PS, as well as our other esteemed speakers. Okay, so I sort of prepared a bit of a presentation just to give an overview of how effective coordination of off-grid solutions can be a driver for investments. And being from the off-grid task force, or focal point person for the off-grid task force, I really truly believe that through a partnership model, there is so much that we can achieve. As Steve highlighted, even in the era of the pandemic and looking at economic recovery, one needs to re-engineer how we think of solutions. If we are to sit back and say the government should be the only player that should be electrifying rural health centers, for example, we might wait another 20 or 50 years for the grid to actually reach some of these rural areas. And yet the need is so vast now, not just because of the pandemic, but it was a need even before the pandemic, but just compounded by the fact that we now have to deal with the pandemic and get the vaccines out as quickly as we can. So, Payal, if we could go on to the next slides. My presentation basically will look at the genesis of the task force, the composition of the task force. For those of you who are not familiar with the off-grid task force in Zambia, some of the off-grid interventions in the marketplace, a snapshot of the activities of the task force, as well as how we actually work. We work through subcommittees of the off-grid task force in really addressing some of the challenges and barriers to market growth, and how coordination also enables investments into the off-grid sector, and specifically how investments and new financing mechanisms can address the needs of the development agenda. So the next slide, please, Payal. So the genesis of the off-grid task force really was that if you look at the demographics of rural areas in Zambia, these pose an immense challenge for delivery of services. Now, whether we're talking about energy services or health services or water services, rural areas, by and large, when you look at the constitution of a village, you will find that a village may be comprised of homesteads which are 3 kilometers apart. It is very difficult for the public sector to service areas where people are literally 2-3 kilometers apart. The capital expenditure of just getting the grid to some of these areas is enormous. And so really, I think that was the whole conversation of how do we provide services to the rural areas, but look at technological advancements. So if you look at the communication sector, for example, today a grandmother in Mbala is able to make a call. She has connectivity. She can connect with so many other people in the country and around the world using the mobile network. And yet, when we look at energy services, we're always looking at grid extensions. People in the rural areas are relying on the grid to be extended into those particular areas. And yet, I think what we need to be able to look at are there solutions? Is private sector and academia looking at new solutions where rural areas do not need to wait for the grid? So in that respect, also just recognizing that energy is one of the key enablers of economic growth and development. Government basically worked with the cooperating partners and the private sector to come up with a coordination mechanism. A lot of funding and interventions were being created to really look at the off-grid space. How can this market be developed in Zambia, knowing that it's a very nascent market? Of course, East African countries had a track record. They had business models. Unfortunately, in Zambia, at the time when the Off-Grid Task Force was created in 2018, it was a very nascent market. And government's ambition for providing energy to rural areas and reaching the goal of universal access meant that government really needed to create some sort of a platform where a lot of the players could actually engage with each other and create partnerships. And as a result of those partnerships, then the Off-Grid Task Force was born, which obviously facilitates the coordination of various stakeholders. The Off-Grid Task Force is an action-oriented mechanism under the Ministry of Energy. And this is really to address market growth challenges and barriers, and also highlight the investment opportunities. So in 2018, the Off-Grid Task Force was born out of quite a lot of consultations between government, cooperating partners, and also the need arising from the private sector to see access to finance, as well as them bringing to the fore the many barriers to market entry. So just going into the structure of the Off-Grid Task Force. The Off-Grid Task Force is comprised of representation from government, cooperating partners, as well as the private sector. The permanent members of government are the Ministry of Energy, who are the chair of the Off-Grid Task Force, ERB, which is the Energy Regulatory Board, RIA, Rural Electrification Authority, Ministry of Finance, Ministry of National Development Planning, and the Office of the Vice Presidency. This was necessitated because energy really as an enabler has got so many intersections with various sectors. So for example, today we're talking about the intersection with health, but it has so many different intersections with economic drivers, such as the agriculture sector and the manufacturing sector and the like. From the cooperating partners, we've got representation from the European Union, from Sweden, from UK, from USA. The World Bank is represented, African Development Bank, IFC, and the German Embassy, as well as KfW and GIZ under the German Embassy. With respect to the private sector, we've got associations. There are 5 seats. One of the associations is the Zambia Renewable Energy Association. We've got the Solar Industry Association of Zambia. Bioenergy is a cluster, primarily because there are various different associations, but no one bioenergy associations, and therefore we've got a group of industry players that are represented. Mini-grid players, also in the formative years, we found that there were very few mini-grid players, and they formed a cluster as they did not have an association. But as things are evolving, they're also looking at creating the Zambian chapter under AMDA. Finance is also a key barrier that was cited in terms of the off-grid space. And so we have representation on the finance cluster at the moment, we've got representation from Development Bank of Zambia, Bankers Association of Zambia, FSDZ, RUFEP, and quite a lot of the other partners that are coming in from a funding mechanism perspective. So the composition of, as you can see, the task force is multi-sectorial in nature, and basically represents all the stakeholders in the market with a view to to really look at the challenges and market barriers, but not just the challenges and the market barriers, but really just synthesizing all the information and data coming out of the market and highlighting various opportunities, and especially for investments. Next, please. So I'd like to give you a feel of how the task force works. In addition to having this multi-sectoral platform, the off-grid task force actually works through specific activities. We have a list of action items which have been approved by the off-grid task force, and we believe that we are a very action-oriented coordination mechanism. And some of the activities, for example, that we've been looking at are tax incentives and customs procedures for solar products and clean cooking solutions. These are some of the barriers that have been cited by private sector to say, although we do have some tax exemptions, sometimes the procedures at customs are not in line with what perhaps the SIs or the regulations are fit for creating the incentives of bringing the products into the market. By energy programming here, we're looking at investable business models. This is again a very nascent market in the bioenergy space, and we really are trying to understand what are some of the business models. The regulatory framework, a lot of this work is being done by the EU, our partners, the IREP program, really looking at the regulatory framework for mini-grids and understanding what is the intersection between on-grid as well as off-grid solutions, and how do we then create an enabling environment. There are also challenges and opportunities from a consumer finance perspective. So although a lot of the private sector players would be effective partners to the public sector in service delivery, we also find challenges with respect to consumer finance. And so you find that perhaps from a demand side perspective, there may be demand, but the ability and the capacity to pay for those services is quite limited and challenging in the rural areas. And so these are some of the barriers that we're also looking to address. Developing financing models for increased participation by local private sector in service delivery. This is very important and almost at the heart of some of the concerns and coming out of Ministry of Energy is how do we galvanize support into local private sector in providing the energy solutions in the rural and peri-urban areas. And again, servicing the needs of deep rural areas. Like I mentioned in the beginning, our rural areas are defined by homesteads, which are several kilometers apart. And so if we are to reach the deep rural areas with current business models, what do we need to do to provide an enabling environment? Does this mean that we need to create smart subsidies for the private sector to provide services to the deep rural areas? Are they the latest technologies that need to be utilized? Perhaps mini grids again would not be a viable option. Is it an increased uptake of solar home systems? So those are some of the discussions and issues that we deal with. Understanding investment opportunities and interconnectivity with other sector investments is also important. So this is very much connected with the consumer finance aspects, in the sense that if you've got a downturn of the economy as we do today because of the pandemic and several other reasons, what then actually happens with respect to consumers being able to afford some of the energy services. And so it really is important to understand what is the impact of some of these global issues or national issues, but how does that also impede investments coming into the country, into those particular programs, and also to help private sector provide a delivery mechanism. Next, please. So basically just giving a little bit of an overview. By no means have we, I think, provided all the various financing as well as off-grid program support. But just to give you an indication of exactly what is happening. In 2018, it was when we were establishing the off-grid task force, it was a very nascent market. Today, we're proud to see so much support from the cooperating partners, as well as other institutions who are coming on board with specific either financing programs or technical assistance that actually then create pathways for funding. So as you can see, we've got many players on the market. We have funding from Finland and Australia. We have funding from Australia, Canada, Denmark, the Netherlands, Sweden, UK, the EU. Already here you've got quite a few interventions. Next slide. If anyone is interested in these particular slides, you're welcome to contact Pyle, would be able to share the slides with you. And again, we've got some more programs in the off-grid space that are providing finances to the private sector or their public sector financing programs, technical assistance as well. And these would be either under the solar home system or Pico Solar, mini grids, productive use, or the bioenergy and cooking solutions. Next, please. So as I mentioned earlier.
Sorry to interrupt, Sebera. If you could just try to wrap up in the next minute or two, because we need to move on to the other speakers. Thank you.
Thank you, Payal. So as I mentioned, we are a very action-oriented task force, and at the task force, we basically run through the action list through subcommittees. We have a subcommittee on fiscal incentives, a subcommittee on land rights, consumer affordability, private sector coordination, as well as finance. And it really is about addressing some of the barriers for market growth and some of the things that we've been working on since 2018. Next, please. So I think today I would just like to maybe just point out that coordination also provides investment flows into markets. Increased coordination, I think what we've seen at the Off-Grid Task Force is coordinating all the various mechanisms and programs under one umbrella. Basically creates an enabling environment for both state and non-state actors to deliver services to the rural areas in an organized way. So we're also able to gauge whether there are gaps or if you find that some of the programs have got either duplications, and those are some of the things that we also look at. And coordination definitely helps in identifying some of the barriers to investments into the markets. It provides opportunities for system transformation and creates pathways for increased investment flows from both public and private sources. And this is basically what we've been we've been seeing. In terms of the resultant effects of the pandemic. Hello?
If we can just make sure that all the speakers please have yourself muted. And Sebera, I'm really sorry, we still have 3 other speakers in a panel, so I'm just going to give you the last word now.
Okay, so the point I was trying to, so maybe just the last slide, Payal, just wanted to just wrap it up by saying that the off-grid task force with the coordination has really helped from a programmatic approach in garnering support for investments coming into Zambia, and so I think it is an effective forum for various instruments to be developed to really think through creating a think tank, think through what are some of the challenges and how do we actually address those particular challenges. Thank you very much, Payal, and over to you.
Thank you, thank you. All right, with that, I'm looking really forward to move on to the next speakers, and it seems, Alexandra, I'm not able to turn on my camera, so maybe the video, maybe you're able to do that. And I'm happy to introduce our second speaker. It's going to be Mr. Brian Sankala Mainza, who is a renewable energy specialist working for the Ministry of Energy. He oversees the development of new and renewable energy sources, and he's the national focal point for the International Solar Alliance, Africa Clean Energy Technical Assistance Facility, and a few other projects at the Department of Energy. Today, he's going to speak to us about what it's going to take in order to scale up electrification of rural health centers. And I turn the mic over to you.
Hello, Payo. Hello?
Yes, hello. We hear you.
Oh, you're able to get me? Okay, thank you. Good afternoon, everyone. I'd like to speak about what it's going to take to electrify the rural areas, the rural health centers in rural areas. I think Sebera has covered a lot of grounds in terms of what the government intends to do in the off-grid space to assist the electrification of clinics and rural health centers to ensure that there's access. The main goal of the Ministry of Energy is to make sure that there's increased access of energy everywhere else. But if you look at the access rates in rural areas, they're really low. We are talking about less than 8% of electricity access in rural areas. And some of the places that are in these rural areas is schools and clinics. And the clinics are really affected in terms of, you know, the maternal death and many other health challenges that, you know, occur during the night when the issue of electricity is very much required. If you look at the challenges that nurses and health workers face in rural areas, ranging from refrigeration of medicines and just the general lighting, especially in certain sections of the clinic, such as the maternity, it's really difficult. And those of us in towns really take it for granted that everywhere else the situation is okay. But having gone in rural areas and seen the situations for myself, you'll find that electrification, which is supposed to be very easy, is actually a big challenge. So the Ministry of Energy, having observed all these challenges and how it affects also the issues of education, we also looked at the central settlements that are there in the rural areas. It was seen that off-grid systems are one very good way of electrifying the rural areas. Maybe just I say more about the settlements. In rural areas, because much of the preoccupation is farming, so there are distances between houses. So for you to do grid extension, like Sebera said, it's quite costly. So the best that you can do is to install off-grid systems that would assist these homes and rural health centers. So there's been a deliberate move to support the off-grid systems, and some of them have come through initiatives such as the off-grid task force, of course.
Brian, are you still there? It seems we're not able to hear you.
The fiscal incentive, the fiscal tax on this system.
Brian, it seems you're going in and out. So
the solar home systems, including the solar home systems in clinics. Also, as gone ahead through the rural electrification.
Alexandra, can you confirm that others are having difficulty hearing? Brian?
Yeah.
Yeah, okay. So we'll try to get him back on. I think he's out in the field, so that might be part of the problem, but we'll maybe call him in. But in the meantime, why don't we go ahead and move to the next speaker? And it's our pleasure to have Mr. Mel Lawrence, who is the RR of the UNDP office here in Zambia. And he's a citizen of France and has a career of over 25 years in development working with NGOs. And he's been working for the UNDP for close to 14 years. He was the country director of UNDP in Guinea, West Africa. He's also served in Sierra Leone as the UNDP's head of programs and supported in reprogramming its interventions to respond to the Ebola virus disease outbreak. So unfortunately for you, Mr. Lawrence, this is not the first time having to deal with an epidemic. But we're very, very excited that you've taken time out of your busy schedule to be here today. And he's going to be talking to us about innovative financing models. And so the floor is yours.
Thank you very much. Thank you for the opportunity. I have a short presentation. Can I share my screen?
Yes, that should work without a problem. The green button.
All right. So
Excellent.
You should be able to see my presentation. Yeah. Can you confirm you're seeing it?
Yes, we see it. It looks great.
All right. All right. So good afternoon, good morning. Thank you for the opportunity in joining this very crucial conversation on solar health and off-grid systems. So I start with a bit of a background for UNDP. In the past few years, UNDP has supported many countries around the world to install solar photovoltaic systems at health centers, but also storage facilities located in poor and hard to reach areas. This has enabled us to learn a number of lessons, and the primary lesson is that there is a dire need to ensure a stable, reliable source of electricity to health facilities. So on average, in sub-Saharan Africa, it is estimated that 1 in 4 health facilities have access to electricity. And among those, only 28% of these facilities have a reliable access. So this first phase of Solar for Health interventions have enabled us to realize that these kind of interventions have a very big impact at the local level. Here in Zambia, we have also undertaken that kind of activities with more than a dozen health centers scattered in remote areas, but also storage facilities with MSL regional warehouses where we equip them with solar systems. So we heard the second speaker. There are a number of incentives to consider installing solar systems in Zambia. The first one, the situation that was described in rural areas by Mr. Brian Mensah from Ministry of Energy, described a situation that is quite dire, and the target for Zambia is to reach 50% of rural areas in the next decade. So there is really need for support and need for acceleration. We've seen also in the past years how the droughts have affected not only agricultural production, but also hydropower generation. So there is a need to diversify the sources of power generation and also to work on climate change mitigation. Lastly, solar systems have become more affordable in the past few years, and now they are more competitive compared to fossil fuel solutions. And of course, in addition to be the more cost effective, it's a responsible choice with regard to climate change mitigation. So for UNDP, we have found ourselves in a kind of a crossroad. We had these interventions in many countries, but we had challenges on how we can scale up these interventions. The first challenge is how to ensure sustainability of solar assets, their operation and their maintenance. Typically, you have a grant, you buy equipment, and after 2-3 years, the maintenance of these systems is not effective anymore, and these systems become dysfunctioning. So how to ensure sustainability of solar assets? A photovoltaic panel lifespan can be up to 20-25 years. So what kind of a system we can think of and what kind of incentive we can put in place to ensure that sustainability? The second, of course, is we're in the middle of the COVID-19 pandemic. We're talking about vaccines. We've seen here, and I can commend the Ministry of Health with the first batch of COVAX vaccines that has arrived in the country and people start getting vaccinated. Of course, the question of cold chain and refrigeration, cold storage is more important than ever to ensure that access to vaccines will be also made available to rural areas. So this has led us to seek and develop an enhanced, more adapted Solar for Health delivery model to support countries that are facing a substantial energy access gap, but also to help them in their green recovery efforts in the Build Back Better dimension, if you will. This model also is designed to make sure that there is an improved access to quality healthcare and delivery in the most remote, vulnerable communities in those countries. And the new model we've been thinking about, the innovative aspect of it is that it is through an energy as a service approach that would be delivered by a private sector service provider company. So why the private sector? Well, we know that to ensure sustainable operation of the solar energy systems, the implementation of innovative business and financing models are needed, and especially led by the private sector. It is not new. Steve mentioned it in his opening remarks. this has been identified as a key ingredient, a key catalyst to achieve the SDGs, to have the private sector contribution and investment. So this is part of this model we've been thinking about. And the first thing we did is last year we conducted a feasibility study in 5 countries, 4 which are in this sub-region, with Malawi, Namibia, Zimbabwe, and Zambia, the 5th one being Liberia. And this feasibility study has identified a number of options, a number of models to work on this sustainability issue that I described earlier. And based on that, we have zoomed into one potential model to try to design a regional program covering these 5 countries. And we are now reached a stage where we're looking for partners. We're fine-tuning the model in each country in consultation, of course, with key national partners, chiefly the Ministry of Health and the Ministry of Energy and other key stakeholders. So what is this program about? The envisaged program proposes a shift from the focus on pure capex financing for the installation of energy generating assets. So in other words, when the government buys infrastructure and maintains and operates. So we're proposing a shift from that model to a model that would be impact driven, which rewards the delivery of clean, reliable and affordable energy services by private sector energy service provider. So in other words, the government is no longer buying the infrastructure and maintaining it. Now in that shift, in the new model, the government is buying energy services from a private sector energy service provider. So the shift in the delivery model is expected to give health facilities access to energy without having to incur upfront equipment procurement costs, while at the same time providing service providers the incentive to ensure service quality and reliability over time. So you understand that this is quite of interest to Zambia, because if the government doesn't have to incur the upfront equipment procurement cost in a context where public debt is high, where the budget to social services is shrinking year after year, it would be quite an asset and an improvement. The second part of it is the built-in incentive for the service provider to ensure the maintenance of the system over the lifespan of the equipment, which would address the question of sustainability. And the incentive, of course, is that they're making money, they're getting paid for the service based on the performance, based on the results that they actually getting. So the model also should enable the private sector to mobilize finance from a range of different institutions like development financing institutions, international impact investors, and even local commercial banks. The model also takes into account the need for strengthening local capacity, both of the government and the energy service provider, in a range of issues, including in financing renewable energy, addressing off-taker risks. The model also offers an opportunity to expand clean energy services to a wider set of consumers. So the idea would be that why providing energy only to health centers when in fact maybe you can reach and serve the neighboring communities that are in the vicinity of these health centers and these called storage facilities. This would have multiple benefits. We heard the first speaker talking about how energy is a catalyst to local economic development, to productivity, and so on and so forth. But it would also perhaps be a possible way to subsidize the cost of these services, where communities chip in and they pay as they go, but all in all, it helps the service provider to actually have a viable commercial enterprise. The program approach is to utilize an innovative, scalable, private sector-led business and financing model that is expected to ensure affordability and sustainability of the provision of these renewable energy services. So the cornerstone instrument is this long-term energy service contract, which is similar to a power purchase agreement, and which will actually take advantage of economies of scale by aggregating the needs from a number of facilities. Instead of negotiating each facility, there will be a bulk of facilities, and also opening windows of opportunities with larger financing institutions. Likewise, the ability to pay the gap of governments can be covered by donor funding. And there is also a consideration for a complementary risk transfer mechanism. So this is basically what is captured in this quite complicated slide that you have in front of you. Now, last slide. What are the key ingredients for the success of the model that we've been able to draw from both our experience of the past years and also these feasibility studies that was conducted last year? And how basically can we catalyze private sector investments? So we believe we have 4 key ingredients. The first one is about de-risking. To ensure feasibility of the model and to ensure private sector participation, adequate de-risking of government ability to pay for the service by donor funding is needed. This is hoped to catalyze private sector investment from distributed renewable energy companies and financial institutions, both national and international. So that's the first key ingredient. The second one, we believe in the need for technical assistance to build the government capacity to be able to tender out and manage the contracts. We think this is a core for sustainability, but we think it's not sufficient. We also believe that it's important to ensure that the local energy provider has the technical capacity to participate and establish partnerships to strengthen the local ecosystem for renewable energy as a service. The last bit that we think is very important, and the first speaker mentioned it, and maybe in a way the off-grid task force could play a role in that, is the need for effective national coordination. We believe there is a need for a platform that could utilize the leadership of the government, but also the comparative advantages of development partners, the investment of private sector, the alignment of donor funding for the successful implementation of the model. And in our model, because it's a regional program covering 5 countries, there is also an opportunity for sharing of knowledge and best practices amongst these 5 countries to identify what's working and what are the success stories to assist the various stakeholders and government. I'll stop here. Thank you very much.
Thank you very much, Mr. Lawrence. It's really great to see how UNDP is thinking about financing, about scaling, but also about the regional knowledge and the capacity at the local or national level, so that maybe in the future we won't need some of the intergovernmental institutions. So thank you very much for that. And I'm very happy to say that, Brian, I understand that you're back with us. Maybe if you want to just take another 4 minutes or so to sort of give us your final thoughts that you had started beforehand. I'll pass the mic back to you.
Yeah, thanks, Payo. I'm back. Yeah, so I think UNDP is also one of our partners that we are working with, and I think Mr. Lawrence has mentioned about the Solar for Health that we are yet to coordinate. We work together with them. There's a project that we started some time back, but I think now it's being actualized. But I think I was at a point when I was talking about fiscal incentives to increase affordability for people in rural areas to acquire the solar systems and be able to at least manage to pay because the taxes will be removed. So this is one of the efforts that we are doing to increase adoption of off-grid systems in rural areas. So I also mentioned about the kind of settlements which makes it very difficult to electrify these areas with grid extension, and off-grid systems are the best that we can do to electrify this. And basically talking about the effect that these connections have on these rural areas, they really change lives. We also have issues of health workers trying to leave the rural areas to come to towns where they can have access to electricity and just better their lives. So if they can access these solar home systems, which are at a rate which they can afford, you can reduce that rural-urban drift, especially for government workers who have many other opportunities to better their lives in towns. It's the same that goes to the teachers. You find that good quality teachers, well-educated teachers would not want to live in areas where they will not have access to electricity. So if we can manage to bring those, electricity services to teachers and nurses in those rural areas, you're able to improve the lives. So they won't leave those places and come to the towns, and then you leave, less qualified teachers and nurses in those areas to cater for people. You end up not doing the mortality rates, and also the education system, is compromised. But with the increased adoption through government, policies and so on, you're able to just improve generally the livelihood of people. And we're very glad for the support we are receiving from staff, from UNDP, and many other from EU, and many other, partners and stakeholders in this. They make it very easy for the Ministry of Energy to implement some of these policies. And sometimes they come with ideas that perhaps were not really on our plan to develop, but we find a way of incorporating those good plans most of the times to try to assist people in the rural areas to increase the access rates to electricity and generally improve their livelihood. So perhaps I can stop here.
Thank you, Brian. And if I remember correctly, you're actually in the field. So I really appreciate that you still got on to be with us. And now I'd like to introduce the last keynote speaker, and it's very much with pleasure and with an honor to be able to introduce Dr. Kennedy Malama, who is the Permanent Secretary of the Ministry of Health. He is a doctor who graduated from the University of Zambia School of Medicine back in 1994 and has worked for the past 24 years in the Zambian public healthcare system, holding various positions at district, provincial, and now national level. He holds also a master's degree in public health from the University College Dublin in Ireland, which he obtained in 1994. From 1995 up to 2016, he served as the District Director of Health and Provisional Health Director in several districts in Zambia, during which time he combined administrative and clinical roles in both urban and rural settings of the country. And in 2017, in August, His Excellency, the Republican President of Zambia, appointed Dr. Malama as Permanent Secretary of the Ministry of Health, the Chief Executive Officer, which is the position that he currently holds. And today he's going to address the electrification of rural health facilities in Zambia, a catalyst to a healthy and productive population. And again, a very warm welcome to you, Dr. Malama, especially during the middle of a pandemic, and understanding that your ministry just recently kicked off vaccination in the country. So it's quite an honor for us to have you here today.
Thank you. Thank you very much, Payo, for that humbling introduction. I want to go into the protocols just to say I recognize all the distinguished colleagues who are connected and there's so many who are following this very important engagement. Thank you for this opportunity to be part of this important, appropriate, and timely event, which we've dubbed the electrification of rural health clinics in Zambia using off-grid solar solutions. As you rightly pointed out, Payo, COVID-19 has once again given us a chance as the global village to be reminded that we remain vulnerable as long as our public health threats and emergencies are not prevented. Here in Zambia, we've seen that COVID-19 has penetrated the rural, remote parts of the country where we thought this pandemic may never reach. Having said that, let me also state that the government of the Republic of Zambia remains steadfast in ensuring that continuously we improve the health and livelihoods of our people. And this is articulated in our country's Vision 2030, where we aim at making this country a prosperous middle-income country by 2030. So that is the developmental agenda for Zambia. So the question then is, how does the health sector comes in? For us, as a Ministry of Health, our focus really is to ensure that we push this agenda towards attainment of universal health coverage, in which our people have access to affordable, cost-effective, and quality health services without suffering financial hardships as they do so. And this is the process, this is a journey, and we are convinced we shall reach that status. Nevertheless, we believe this can only be achieved when investment in the health sector is anchored on health systems strengthening through an integrated primary healthcare approach, which is spanning promotive interventions, preventive, curative, rehabilitative, and palliative care services. You cannot talk of universal health coverage when one of these key pillars is not included. In addition, we need to ensure that there is further strengthening of systems so that they are resilient in our country. And when we talk of the key pillars of a functional healthcare system, we are talking of availability of adequate and competent human resource for health, adequate healthcare financing, health infrastructure, and health infrastructure is very key to what we are discussing this afternoon for Zambia. Availability of essential medicines, supplies, and other medical products. And this has been well articulated by my colleagues who spoke before me. Health information systems and research, and leadership and governance. We need to ensure that we invest in these areas in a smart way as a country. Therefore, to improve health service delivery in Zambia, electrification of rural and remote health facilities becomes an imperative for us to have a healthy and productive citizenry. There is no way we are going to talk of universal health coverage. There is no way we are going to talk of health for all if we are not prioritizing investment in bringing electricity and power to the rural and remote parts of our country. It is clear that without access to electrification of health facilities, we will continue leaving 70% of our rural population in Zambia behind, making attainment of sustainable development a pipe dream. Yes, startup costs when it comes to solar, off-grid solar investment may be on the higher side, but medium to long-term dividends are plenty, particularly when you look at the lives to be saved, or indeed the lives saved by that investment. Electrification of rural and remote health facilities in Zambia has the potential to translate into quick improvement on health outcomes for millions of our people. As I stated before, 70% of Zambia's population is in the rural part of our country. And as it was mentioned earlier, in Zambia, most of our people are sparsely located, making planning and investment a challenge. It's also clear that the World Health Organization reminds us that electricity is a critical enabler of universal access to healthcare, and that without electricity, many life-saving interventions simply cannot be undertaken. Meaning, as much as you may invest in many other areas, if you neglect electricity investment in the rural remote parts of Zambia and indeed many other countries in the sub-Saharan Africa, then we are scratching on top. We need to go deeper for us to be impactful. Therefore, electrification of health clinics will not only contribute to sustainable development goal number 3, which is focusing on health and well-being, but it will also catalyze SDG number 7 on affordable and clean energy and SDG number 13 on climate change. And all these are very fundamental to sustainable development of our population, including those in rural and remote parts of our country. If we don't electrify rural remote health facilities in Zambia, then we should forget about attainment of sustainable development. And I speak not only for Zambia, I'm sure what I'm saying is applicable to many, many low resource settings around the globe. Electrification of rural and remote health facilities, therefore, catalyzes improvements in health service delivery. And my colleagues who spoke before me eloquently explained that. But let me re-emphasize, this includes motivation to health personnel. In Zambia, we did a study years back, and it was surprising to note that motivation when it comes to the living conditions of healthcare workers, which includes housing, electrified housing, so that they are able to improve their well-being, they are able to watch television despite being in the rural remote, transport, in other words, non-monetary incentives were more critical to the retention and motivation of healthcare workers in the rural and remote parts of this country than the monetary incentive. This is also key to retention of health personnel, as it improves their working and living conditions and environment in which they provide healthcare services. It's also critical, as it was mentioned, when you electrify a rural remote health facilities, cold chain equipment is available, which means they're able to deliver life-saving interventions to the rural and remote populations. The vaccination program will be enhanced. As you know, vaccine preventable diseases are the highest cause of morbidity and mortality in our settings. So when you electrify a rural and remote health facility out there, you are saving so many lives because they will be fully immunized and become resistant to otherwise conditions which may end their lives. Today we are talking of COVID-19, and indeed my colleagues alluded to the fact that Zambia has received its AstraZeneca vaccine for COVID-19. This vaccine is not only for people in the urban and peri-urban parts of Zambia, it's for all Zambians. And therefore, the rural and remote parts of this country, having appropriate cold chain to store the vaccine at +2 to +8 degrees Celsius, will make them be part of this success story of preventing COVID-19 in the rural and remote parts of the country. They shouldn't be left alone. Yes, we cannot take power to them using the national grid, but there are solutions as we are discussing this afternoon. And once again, COVID-19 has reminded us that if we don't invest smartly into our health systems, today it's COVID-19. Tomorrow it will be another public health threat or emergency, and that is not sustainable in terms of responding. Again, when we electrify rural and remote facilities, we are enhancing maternal, newborn, and child health services. People who have worked in the rural area will testify. Conducting a delivery in a remote and rural health facility with no power is a daunting task. Your safety as a health worker is threatened, and also the success of your delivery becomes a daunting assignment to take. you see broad smiles on health workers when their facilities are electrified, and you see the motivation. And immediately you start seeing the outcomes in terms of babies who are born alive compared to those who are born dead before and after intervention of electrifying. The issue of conducting operative surgery, critical care and provision of anesthesia, basic diagnostic services are all enhanced. When you look at storage of medicines, which my colleague referred to, the supplies and other medical products is also catalyzed once you electrify those facilities in the rural and remote parts of our country. In the health sector, we believe in evidence. Whatever you do, you need to report, document, and use it for taking action. When you electrify a rural remote health facility, you are giving them an opportunity to enhance health information systems. And they are also given an opportunity to use the various electronic platforms to engage and participate and ensure that continuously they are improving service delivery. This investment we are discussing today is key if we are going to improve the health and livelihoods of our people. And the key is to ensure that we continue focusing on primary health care. And that's why when we say electrification of rural and remote parts of this country, that is the bedrock of the healthcare system. That is the primary healthcare component. For instance, in Zambia today, we've been constructing health posts, 650 health posts. So far, we've finished 563. We are constructing mini hospitals, 108. We finished 42. And we are constructing 36 district hospitals. One thing we've realized is that without power, all these facilities would not serve the purpose. And that's why under the health post, solar power was prioritized, and so are the mini hospitals. But of course, gaps remain in terms of ensuring that all our facilities do have power, particularly off-grid power, which is catalytic to improving health service delivery. Let me mention that one of the key challenges we face at the moment in the health sector in Zambia is that only 27% of our health facilities in the rural and remote parts of our country have a functional connection to the grid, while electrification using off-grid solar systems has not been utilized due to inadequate investment, despite evidence and its impactive potential. And that's why this engagement this afternoon is bringing reality and trying to translate it into action. It is clear globally, in the region and in our country, that off-grid renewable energy solutions are cost-effective, and this has been alluded to. It can be deployed rapidly, and it offers reliable solutions. But the question to all of us is, how can we smartly expedite this investment? As a ministry, we are therefore delighted that working with our sister Ministry of Energy, we are partnering with the Africa Clean Energy Technical Assistance Facility in developing a comprehensive set of activities to help bring electricity to our countries and electrified healthcare facilities, the rural and remote, the place where the game is played, the game changer to the health sector. I would therefore like to put on record our appreciation as government through Ministry of Health to the UK Foreign Commonwealth and Development Office, the World Resources Institute, and the Power for All, who are providing financial and technical support to this life-saving initiative. Let me also recognize the UN family, UNDP, for always rallying behind Ministry of Health and the government at large when it comes to cutting-edge solutions to the various challenges we continue facing. It is clear that with the scope of the work before us, we are strategically working hand in hand to now map up the current electrification status of health clinics in our country, quantify the energy needs, and convene an intersectoral multi-stakeholder coalition, including the public and private sectors, civil society, financiers, and donors, to identify an actionable way forward. Indeed, this investment we are talking about is unprecedented, and we all look forward to a time when we shall start counting how many rural and remote health facilities are electrified, and to quickly link that to the patient outcomes, population outcomes, and impact in the health sector and in the broader developmental agenda for this country. I would like to further stress that the capacity to electrify rural and remote health facilities to scale and in a sustainable way is within our collective reach. Not only will this improve the quality of life for countless people, countless Zambians, but can also serve as a model for the rest of Africa and other regions of the world on how to improve health outcomes with clean, smart energy. It will enable that pregnant woman in Mapamba. For those who don't know Zambia, Mapamba is an area in Chama district where you are working at a health facility and lions are passing few meters from the facility. It will enable my staff in Mapamba in Chama district to conduct a safe delivery. It will enable that child in Lupoi, a remote area in Mitete district, far-flung area of Zambia, to be fully vaccinated and be protected from vaccine-prevented diseases. It will enable that health worker in Chavuma district, in the remote and rural parts of northwestern province of Zambia, to be retained at that remote facility and continue saving lives. I wish therefore to thank all the developmental partners, stakeholders who are part of this movement for their continued support, and we look forward to continued collaboration and to the successful execution of this project so as to improve the lives and well-being of our people and catalyze Zambia to becoming a middle-income, prosperous country. Master of Ceremony, I thank you for this opportunity. Thank you very much.
Dr. Malama, thank you very much, in particular for reminding us about the fact that electrification actually can mean the difference between life and death for a number of not just Zambians in rural areas, but also in my home country, India, and across the world. And also for sharing with us what the government is doing in order to make that a reality and to improve the well-being and lives of all Zambians. And with that, we've gone a little bit over time, but we've had such engaging speakers, and I know that there have been a number of questions. Right now, I'm just going to take one of the questions, and afterwards, we're going to jump into the panel discussion, because I think it's a great complement to what we've just heard, and we'll try to pull in some of these other questions at the end again. But the question that I would like to go with, which I believe that either Dr. Malama or Brian, you would be able to answer, and it's really around this area of regulation. You know, where do you see that there are gaps in the legal and regulatory framework in order to make the electrification of rural health centers a reality? And the corollary to that is, what policies or what schemes do you think your government could put in place to encourage the private sector? So I'll give you both a chance to quickly chew on that and maybe come in with a couple of comments. It's quite a big, wide question. And then we'll move on to the panel discussion.
I'll allow Brian to go first. Brian, over to you.
Thank you, PS. Payo, maybe you can just repeat the question. I get it clearly.
Sure. If you want to talk about the policies that are in place that enable electrification of health clinics, as well as what is missing, And then a corollary question is around what the government is doing to promote the participation of the private sector. And maybe we see that maybe a colleague from the Health Ministry, Jason Wamulume, might want to step in as well.
Okay, thank you very much, Fayo. Yeah, so the policies of electrifying the rural areas are in the establishment of the Rural Electrification Authority. It was specifically established to improve the connection rates in rural areas. So under the Ministry of Energy, we have that component, which is the implementing the agents to facilitate the rural electrification agenda for Zambia. In terms of the other policies that are there, it's the policies interventions that we have that hinge on renewable energy development, such as the renewable energy strategy, the renewable energy feed-in tariff. These are strategies that we've put up to ensure that there is more uptake of renewable energy, which is the solar that we are talking about in this meeting, and the off-grid, of course, to electrify rural communities. So such policy interventions that we've put up also include the participation of the private sector, because they involve, tenders and so on, and there is a specific inclusion of government not going out there to actually install ourselves, though we do that sometimes, but it also includes government participation. And we've worked with some of the companies which are on this platform, such as Muhanya Solar, just to see what we can do to improve these clinics. Some of them are also being done from Undp side. Some of them are being done from many other projects that are government related to try to install these. But the specific policies that I can say, which we have deliberately done, is such as the renewable energy feed-in tariff, and also the renewable energy strategy that we are putting up to ensure that we catalyze the adoption of solar and off-grid systems in rural areas.
Thank you, Brian. Dr. Malama or Jason, did one of you want to jump in? Dr. Malama.
Thank you very much. That's why I said Brian goes first, so that he picks the hard ones. For us as the health sector, I think the environment is enabling for private, public-private sector engagement and participation, but also to look at the broader government. The focus is on a whole government approach, where government has stressed the importance of multi-sectoral collaboration at all levels, first within government and also outside. I think generally the legal framework is there to back participation of the private sector in the socio-economic development space for Zambia. I know that within the Ministry of Commerce, Trade and Industry, we do have the industry policy, which also provides certain safety nets and the leverages which can be utilized to enhance investment in this space. We also have the local content strategy of 2008, again anchored by the Ministry of Commerce, Trade and Industry. And those can be used to see how certain catalysts can be put in place to spur this investment. But also important to note for this meeting that Zambia recently passed the Zambia Public Procurement Act, which has been refined. Again, that has been a more responsive piece of law, which can enable such investment be done pretty quickly. In the past, we used to have quite some challenges, but now government has emphasized the importance of electronic government procurement, for instance. We also recently had the Planning and Budgeting Act enacted, and it has also brought in some new things which can enable wider stakeholder participation. But let me also say, you are aware that there is a public-private partnership department under Ministry of Finance, who always also give guidance. And lastly, as a sector, we are privileged to have so many cooperating partners who are willing to work with us. Of course, it's for us as government through Ministry of Wealth to ensure that we work within those conditionalities, including the bilaterals. The World Bank has been key to this, Global Fund and other multilaterals. The UN family for the Ministry of Health has been key, and UNDP is an example, World Health Organization, UNFPA among us. And we see that they are always supporting us in terms of technical assistance and also logistically and materially. Thank you very much. Unless Jason, you want to add a voice, over to you. Thank you.
Thank you very much to both of you, and thanks for all of the presentations from all four of you, the welcome from Steve, as well as the questions. And now I'm very excited, actually. I know people might be a bit tired, but please stay for the second half, or the last half an hour. It's going to be really great, and I'm going to pass over the moderation to my esteemed colleague, Benson Kibiti.
Thank you so much. For the great session and for the great insights we've had from the panelists, from the keynote speakers. So I'm going to ask our panelists today to turn on their cameras, Doreen, Jeffrey, Dr. Zuru, and Jeff, please. And so the reason of having this session is to have a deep dive discussion from a practitioner's perspective, implementer's perspective, a policy advisor, and technical support. And so if I may introduce Doreen, Doreen Bwala, she's the Zambia country manager of the Africa Clean Energy Technical Assistance Facility, ASTAF. And then we've got Geoffrey Kaila, he's the managing director of Muhanya Solar. He has great experience on the ground of electrifying health centers in Zambia. And Dr. Belita Zuru, district health director, Zimba District Health Office, and Jeff Estotmere, senior manager at CLASP. CLASP did a research recently, and so you, Jeff, would be in a better position to really give us some insights on what their findings were when it comes to medical equipment and the off-grid solution. So we have 2 minutes for each speaker to give a brief introduction about the organization and why we need to electrify health facilities with off-grid solutions. So Doreen, probably you could go first.
Thank you very much, and welcome to everyone. As you have said, I'm the country manager for the Africa Clean Energy Technical Assistance Facility. This is a 4-year program that is funded by the UK government, the Foreign Commonwealth and Development Office. It aims to catalyze a market-based approach for private sector delivery of renewable energy technologies, and with a focus of standalone solar systems. The program seeks to complement the efforts of government, of private sector, and also of donor initiatives to overcome the barriers that are preventing the development and scaling up of these solar markets. So our focus is really, and emphasis is really on supporting the poor and vulnerable in the community. So the program basically has 3 pillars. The first pillar looks at supporting government to put in place supporting the government to put in place an enabling environment. In this case, this is looking at putting in place policies and regulations which would also help the market grow. The other pillar we have is that of knowledge management. Here, we are looking at helping in increasing market intelligence of solar successes. Then finally, there's the pillar on coordination. For the pillar on coordination, we're looking at helping the government. In this case, we're working with the Ministry of Energy and the Off-Grid Task Force to ensure that there's coordination on the activities that are currently happening. So we work very closely with Sebera. So coming specifically to Zambia, the ESTAF program seeks to increase uptake of quality off-grid solar solutions by vulnerable households, including health facilities. And also we are looking to also support the government to create an enabling regulatory environment to promote increased private sector investment. So we see here, Benson, that for us, solar for working with the energy sector and the health sector, ensuring that we actually help in electrification of these, using solar is one of an important aspect and intervention for the program.
Thank you so much, Doreen. Geoffrey, being an implementer, Muhanya Solar, could you tell us a little bit about your company and what you're doing in regards to the electrification of health centers in Zambia?
Thank you very much, Benson. Good afternoon, everyone. Muhanya Solar has been around for the past 15 years. We've been implementing off-grid solar solutions for the past 15 years, and we've implemented government programs via the Rural Electrification Authority. We've connected many households on mini grids. We've connected rural health centers using solar. Zambia is very vast, and electrifying rural communities using the national grid is a task that cannot be achieved 100%. Therefore, off-grid solar solutions are really an important part of this rural electrification. And as such, we as private sector play a very important role in achieving that goal of connecting rural communities using solar. Thank you.
Thank you so much. Now we could go to Dr. Belita Zuru, being a practitioner and being in charge of the district health office in Zimba. Could you tell us a little bit about your work, please?
Good afternoon and good morning. Of course, as the district health director for Zimba District Health Office, in Zimba District, we have 12 health facilities, 1 referral hospital, 8 clinics, and 11 health posts, servicing a population of 104,916 people. So of the 11 health clinics that we have, only 2 are along the national electricity grid, meaning that 9 of these do not have access to reliable energy. What is also important to note is that the furthest facility is about 130 kilometers from the national electricity grid. And so it becomes important that we do consider alternative sources of energy in Zimba. Thank you.
Thank you so much, Dr. Zuru. Jeff, probably you could go ahead and talk to us and talk about why off-grid medical devices are fit for purpose.
Yeah, thanks so much, Benson. And it's a real privilege to be here. I really am appreciative of being invited to participate in today's discussion. So I'm a senior manager at an organization called CLASP. CLASP is an international NGO that's focused on appliances, and we have 2 main goals at a high level. The first is to reduce the contribution of appliances to global climate change, by reducing the energy consumption primarily of appliances. And the second is to increase the role of appliances as drivers of access to modern energy services, both in off-grid areas as well as areas and communities with weak or inconsistent grid connections. So we just released a report, our first ever research really, on the role of medical equipment in the context of clinical electrification. So electrical appliances and specialized medical equipment, medical devices that are used primarily in those health post level facilities that Dr. Zulu mentioned. And the report looks, at an issue that I think from our perspective isn't as frequently discussed, perhaps maybe as other issues related to financing and policy. And that is basically the lack of appropriately designed and I think in particular highly energy efficient medical equipment that is best suited for use in clinical settings where there's oftentimes a very limited energy supply. And beyond that, there are fairly harsh operating environments in terms of where and how the products are being used. So we're excited to speak with everyone today. And thank you again.
Thank you so much, Jeff. And maybe we could go to the questions now. And this question goes to Doreen. Of course, Dr. Kennedy mentioned the importance of the partnership between ASTAF, WRI, and Power4All to prepare Zambia for electrification of rural health clinics using off-grid solar. Could you tell us a little bit more about this work that is happening in Zambia?
Sure, Benson. So the ACE staff, that is ACE with WRI and Power4O, are supporting the Ministry of Health to quantify the level of investment that is required to provide sustainable renewable energy to unelectrified clinics. So basically, ACE staff is conducting a study to understand the off-grid energy needs of unelectrified health facilities. In this case, looking at the requirements as well as the costs which are associated with electrifying them. WRI, in this case, the World Resources Institute, on the other hand, is mapping rural health facilities, their electrification status, and also looking at the optimal supply options using what is known as the Energy Access Explorer. Here, I can just divert a bit and just talk a bit about what we mean when we talk about the Energy Access Explorer. Here, this is basically a geospatial platform which can be used by different users to actually understand and also plan for what requirements are needed for the different health facilities. And I'll go later and discuss more onto that. But then let me also talk about the work that Power4O is doing. So Power4O is working to build a national multi-stakeholder coalition that is going to ensure alignment and readiness, and also is going to mobilize financial and technical support from funders and implementing agents so that they can also help once we have an idea of the level of investment that is required to electrify these facilities.
Great, thanks, Doreen. And maybe I could move on to Geoffrey. Having, being an implementing company, deploying all these off-grid solutions in Zambia. Of course, research has proved that off-grid systems present cost-effective, rapidly deployable, and reliable options. How do we ensure the long-term sustainability of these systems?
Thank you, Benson. Let me start by saying that government, for many years, has had very good intentions of using solar to electrify rural communities, including health facilities. But I think the implementation plan is the one that is incomplete. It's incomplete because first they will do the installation, be it through the government itself or through contracts from line ministries, could be Minister of Health or indeed the Rural Electrification Authority. But in the end, when the facilities get these installations, they are left to use them without any plan for sustainability. And as a result of that, these facilities begin to deteriorate, and in the end, the solar solutions stop working. The most weakest link in the solar system is the storage battery, and it needs replacement. Typically for lead acid batteries, it's between 5 to 6 years. So after that period, the line ministries have no budget for replacing of batteries in these solar installations. As a result, the systems become white elephants, so to speak, and they begin to deteriorate, and in the end, there's no installation at all. Therefore, the government must, at the end of each program, if it's implemented by private sector, the private sector then must be kept on and sign operations and maintenance contracts so that these facilities, these solar installations will continue to operate long after the government program have ended, or indeed, if it's grant programs have ended, the end users will still benefit because the implementing agencies will still have a small budget for operations and maintenance and battery replacement. I think from our experience, we've seen that if we use, like previous speakers have indicated, innovative implementation plans, like if we use mini grids to power the community, including the health facility, the mini grid operator will then take care of the power assets, and the clinics will just become clients, and they'll be able to pay a fee for using the electricity. That way, we are building in the sustainability that has been missing for many years. We could also train local village electricians to do the maintenance if the facilities are donated. We could also use private companies to operate as EPCs. They go and build these power systems at these facilities, and they remain to maintain them and get some fee from the community via the cooperatives. So there are so many ways we can build in the sustainability for these solar installations so that they last much longer. I'll stop there for now.
Thanks, Geoffrey. And hearing from a supplier side, it would be interesting to hear from a demand side perspective, and hearing from Dr. Zuru, who is a practitioner, and she's the director, health director. So probably, Dr. Zuru, you could tell us why energy access is so important to the functionality of health facilities, and the quality and availability of health services delivered within them.
Thank you for that question. I believe part of the response to that question was ably highlighted by my PS, Dr. Malama. Yeah, so we really cannot ever emphasize the importance of power in enabling the delivery of healthcare services in our facilities. So like I said, I think just to maybe echo a few points, when you speak of electricity, we are talking about lighting. I think that is something that most of us take for granted. I think for us who offer services, even in the night, when there is lighting, we are assured of safety to start with. And again, that allows us to even operate in the night, because as we know, illnesses don't knock. So even for deliveries, we find that most babies are born at night. I don't know why, but I find that a little bit intriguing. In the cold chain maintenance, even with COVID-19, of course, it's important that we are prepared to receive the vaccines that the national level has procured for all districts. And I'm proud to say that as Zimba district, we receive our consignment in the early hours of today. And we have been able to deliver those commodities to the assigned health facilities because they are well equipped. And so for this purpose, we actually even chose the facilities that are along the national grid for storage of these commodities, even as we prepare for rollout to the other facilities of the grid, where we do have solar support to the cold chain equipment just for the vaccine components. We do have refrigeration equipment to cover for the vaccines, but however, that is not adequate for the other health services. As a country, of course, we are still battling with communicable diseases, and on top of the agenda, we have issues like TB and malaria, HIV. We know that to make a diagnosis of TB, one needs electricity, whether you are going to use a microscope or indeed an expert machine. So you can't do away with electricity. Again, when it comes to malaria, yes, we do have
Hello, hi, Brian, I think you need to mute your mic, please. Great, go on, Dr. Zuru.
Thank you very much. So again, if we speak of malaria, we do have the rapid diagnostic tests that we use, but in the case of severe malaria, we need to quantify that. And so we still need to use a microscope, which will need the electricity to be run. To add on to that, in the management of HIV as a country, we are really making progress in attaining epidemic control, and among priority activities that we are doing is ensuring that the viral loads of our clients on treatment are well known, and that requires that the samples that we draw are maintained in our labs even as we prepare to courier them to the advanced lab where these tests can be carried on. It is the same with COVID-19, actually. We have two tests that we are currently deploying. We have the rapid test and the PCR-based test. And so what it means today is that for the people in the far-flung facilities, if they do collect COVID-19 swabs, which need to be run using the PCR machines in Livingstone, it means then that we have to take care of those samples so that the integrity of the samples is not compromised. And that requires storage in terms of refrigeration or indeed small cooler boxes. And so for us to be sure that these samples are collected at the correct timings, to ensure that they reach the testing lab within the stipulated 48 hours without losing their integrity, we need that support in terms of refrigeration at facility level. The issue of motivation among healthcare workers who we send to these facilities where there is no electricity is one issue really that we wish with electrification we will not have to deal with. Yes, it is very difficult to actually retain healthcare workers in the remotest part of the district. And so we find that there is very high staff attrition in those areas. And so even when we invest heavily in this staff to give them specific skills to manage specific programs, say in HIV, in malaria, in TB, we find that after a few months, a year, maybe for the longer serving ones, they'll be there for 3-4 years, but then they'll have to move out. And then a newer crop comes in, and so we go back to the drawing board. So such are what really makes it necessary that we have power in all the health clinics. I submit.
Thank you so much, Dr. Zuru. And so, having heard from technical advisor, HESTF, the practitioner, Dr. Zuru, and an implementer, the Muhanya Solar, Geoffrey Kyler. Maybe Jeff, to you, I know you did a report, you did a research on medical equipment and clinic electrification. Could you talk a little bit more about the findings of the technical and commercial barriers to large-scale deployment of medical equipment in off-grid and with-grid clinics, along with the actionable recommendations to make progress against these barriers?
Yeah, thanks, Benson. So our report looks, the focus of the report is on the need for more complex and energy-intensive appliances and equipment, really beyond basic lighting that are required for the provision of health services. And we found a number of barriers to the availability and usability of these kinds of equipment, and I'll try to go through them quickly. There were seven main barriers. The first is that there's little to no guidance specifically focused on electrical equipment needs in primary healthcare level settings. The recommended equipment lists that do exist often include non-electrical items like bandages and chemical agents. And they don't include the kinds of performance specifications that are necessary to actually design an energy system. They're also pretty inconsistent across different country contexts. Second is complexity, technological complexity. So the WHO identifies more than 2 million types of medical devices. It's a lot that are available globally in 22,000 different categories. Obviously we know that a lot of those probably aren't that relevant for primary health level facilities. But even among the ones that are, different devices, can deliver the same health service using fundamentally different processes, right? So you can sterilize, a sterilizer can perform in a number of different ways that has implications for the energy requirements. Third is design. So most existing medical equipment and appliances are highly energy inefficient. They're designed for use in hospital settings in North America, Europe, or East Asia, where there's basically an infinite supply of stable electricity. And beyond that, there's hardly any equipment that's available that's compatible sort of off the shelf with DC power that's generated by off-grid energy systems. So there's a number of design challenges that we face. Fourth is regulatory. So regulatory regimes for medical equipment are relatively immature or in some cases non-existent. And the regulations that do exist are almost all focused on safety and reliability. There are no energy standards, for example, for most types of medical equipment. And then, very quickly to the last three, the fifth issue is donor priorities, frankly. Large public health programs are oftentimes focused on a specific health outcome. And so the equipment that's procured through these programs is focused on the provision of services related to that health outcome, and doesn't, it's oftentimes hard, frankly, to take a holistic approach to all the kinds of equipment that may be needed and beneficial in a clinical setting, given the design of some of these programs. Sixth, and this was one that was kind of surprising to us, and I wish we had more time to discuss it as a group, because I would love to get folks' perspective on it, but equipment dumping. So in some countries in the global south, up to 80% of all medical equipment has actually been donated, primarily by large global corporations. And those donations come for a variety of reasons, but they can be very distortive in terms of the development of competitive markets for better and more appropriate equipment. And then the last challenge, it's probably not surprising, it's just sectoral silos. So there are, obviously like what we're participating in today, there are platforms now for dialogue between the health and energy sectors, which is hugely important. But I think we need to take that a step further and create dedicated space to talk about the actual design and deployment of devices and electrical appliances and medical equipment that would allow clinics that do get access to electricity to deliver a broader suite of health services and have that be sustainable over time. I think I'll stop there just given time, but those are sort of the high level challenges that we identified.
Thanks, Jeff. And probably if I may come on what you've just said, in terms of the innovations, that off-grid innovations that you found based on your report, what kind of recommendations, probably what kind of innovations, off-grid innovations would you recommend to address the biggest challenges in the power and health facilities?
Yeah, the first, and I would love to get Jeffrey's perspective on this. He's been in the field trying to deploy these systems in particular, but what we'd like to do is try and distill, work across all the existing lists of recommended equipment that come from WHO, that come from various ministries of health, and distill that into an equipment list, a succinct equipment list focused primarily on that primary health center level, that includes all of the specifications that are needed for designing an energy system that will power a given load. So it takes a lot of the guesswork out of procurement, equipment selection, and energy system design that we heard a lot, in particular from the off-grid energy solutions providers who are trying to design and deploy these systems, that they spend a lot of time trying to figure out which devices should be included in their solutions, and in particular that would allow them to maybe operate across multiple country markets. So getting that, getting sort of broad buy-in to a succinct list of electrical appliances that should be in a clinical setting, and then including the actual performance metrics that are necessary for designing the systems is one thing that we think could really be important. But then I think also something that would be very helpful in terms of driving improvement in this challenge over the long term. It's just raising awareness among some of the larger global medical equipment suppliers that there's even a need for, sort of rethinking the design of some of the most important types of medical equipment so that they make them more energy efficient, so that they make them in ways that allow them to withstand voltage fluctuations and, the challenges that arise from having inconsistent and intermittent supply of energy. As well as some of the sort of design adjustments that may make the products more usable for a longer timeline, right? So basically getting a better understanding of what equipment should actually be included in these clinical settings, and then engaging with medical equipment suppliers to make sure they're making these products in the most appropriate way, so that they're usable and they function for a long timeline. Thanks.
Thank you so much, Jeff. And I see we have less than 2 minutes, and maybe to Geoffrey, who is deploying these solutions, you could go ahead and share with us some of the vital lessons learned and best practices, and probably what will it take to scale up quickly in terms of deploying these solutions?
Oh, thank you very much. One interesting lesson that we learned is that because of stringent budgets, most deployments were only for the actual clinic and not the staff houses. as a result of that, the system never lasted because it was not only used for medical use, but to power medical equipment, but it also powering household appliances, because over the weekends, the household would use the same electricity to watch TV and do all other domestic needs. So as a result of that, the system didn't last. So in order to scale these systems, we need to not only power the facility, but power the households. I think this point has been hammered by previous speakers as well. The other item to increase this program and scale it up is to use train more technicians in these rural communities so that they can begin the deployment themselves, as opposed to relying on people from the city. So if government can create these programs and create a fund that would allow this scaling, then I think would achieve this goal very quickly. Also, we would also need donors or grant funds to be available and be given to private sector so that they can scale up as part of the program. So I think I'll probably just leave it there and give time to others. Thank you.
Yeah, and probably Doreen, Jeff, and Dr. Zuru, is there something that you'd want to respond on what on that question in terms of the best practices and lessons learned?
Yes, I can just quickly come in. I think just from our experience as a staff, and one of the key issues about the importance of government creating an enabling environment to promote private sector investment and also to allow partnered support. So the role of government really is to ensure that there's the correct policies and regulations. The issue of incentives has already been talked about. Another important thing is that of quality assurance and standards. And also we heard from the previous keynote speakers around the issues of effective coordination and the importance of that to ensure that there is equitable use of resources and we avoid duplication amongst the different players and the different donors as well. And Geoffrey has talked about skilling. So I'd also just like to indicate that some of these activities, especially on quality standards and incentives, are some of the things that A-Staff has been doing, working with the government to actually support this process with the revision of statutory instruments, which are looking at exemptions or tax and VAT exemptions, as well as with the adoption of IEC standards, which have now been adopted, and now we're supporting with the process of developing a regulation. So all this should actually help in creating an enabling environment to actually allow for private sector investment. Thanks.
Thank you so much, Doreen. And to our attendees, we know that you had sent us so many questions, and we will make sure to work with the panelists to make sure that we respond to your questions. I'll end the session and hand it over to Pal.
Yes, so I think our stomachs and our ears were bigger than the amount of time allocated today, but and we realizing we could have done 2 long events as opposed to squishing them together, but very appreciative of all the participation from the audience, in particular, the number of questions that have come in, and we will find a way to ensure that some responses get back to you. A huge thank you to all of the speakers. It was a lot of food for thought, in particular, the Permanent Secretary, Dr. Malama, taking so much time out of his day, as well as Mr. Mel Lawrence, and of course, Dr. Zulu, where you're also trying to get people vaccinated and take care of people's daily needs. I want to just let you know that in the chat, I sent you ways in which you can follow A-Staff as well as WRI, as well as Power for All, but also that we are having with CLASP, for those of you that are more interested in the issues with regards to, here we go, here's what I'm looking for, with regards to appliances on the 5th of May, so Cinco de Mayo, for those from Latin America, we will be having an event at 15:30 Zambian time, CET, 13:30 GMT, that is going to focus a lot in more depth around that issue, along with UNICEF and health care without harm. And with that, please feel free to contact Doreen or me if you are interested in the work that we are doing in Zambia on electrification. We would be very delighted to talk to you more about the coalition, and it would also be a chance to work further with Dr. Malama's department, as well as with Brian, Sebera, and hopefully with the team from Mr. Lawrence as well. And with that, I wish you a good afternoon, a good evening, a good rest of your day. And again, Ramadan Kareem, Ramadan Mubarak to all that are observing.